gynecology books published. These books can be seen in other interviews of mine here in the YouTube. And now I would like to give a specific and short message. Along decades, as an exclusive gynecologist, I don't practice obstetrics, nor do I practice gynecologic surgery. I advocate the separation, a definitive separation of gynecology from obstetrics and gynecologic surgery, as unfortunately continue being done, as far as I know, all over the world. After publishing and discussing and proving with medical arguments that there are absolutely no reasons for keeping gynecology attached to obstetrics, unfortunately, I have to face the gyneco-obstetric or Ob-Gyn brigade, who fights for keeping that wrong situation. They have a great professional interest in practicing simultaneously gynecology and obstetrics, simply because they have much more patients, and for some reasons women unfortunately are unable to perceive the big medical and scientific differences between gynecology and obstetrics, and they are addicted to being assisted by physicians who practice both specialties simultaneously. They practice both specialties simultaneously badly. Usually they practice one of them well and the other one badly. Well, regrettably, I have been for decades unsuccessful in my attempts at promoting the separation between the two specialties. I'm becoming convinced that a considerable part which is responsible for the maintenance of this situation is in women and the patients themselves. Besides the continuation of this practice, the insistence of continuing this practice on the part of the professionals of the gyneco-obstetricians, there is a considerable part which is played by patients. The fact is that though women are, I suppose, able to medically understand the differences, the deep medical, scientific differences between both specialties, emotionally, they are attached to physicians who wrongly practice gynecology and obstetrics. For instance, another day, a friend of mine, a woman who read my book, New Perspectives in Gynecology, told me she liked the book, but she doesn't agree with me about the separation of gynecology from obstetrics, because she is used in being treated by gyneco-obstetricians. Okay, that's her position. I'm quoting here and mentioning here only one example. But with time, I'm realizing, with the passage of time, I'm realizing that a great part of the blame for keeping gynecology attached to obstetrics lies on the patient's part. Women are, to a great extent, responsible for the maintenance of this situation. And of course, the Ob-Gyns, the gyneco-obstetricians, have a great advantage on this emotional position of their patients for keeping that situation. So I apologize, women, but I have to blame them for the maintenance of this tragically wrong situation regarding this tie, this eternal tie between gynecology and obstetrics.